For the first time ever, the Utah Legislature is using taxpayer dollars to fund crisis pregnancy centers. $400,000 will go to two groups, Pro-Life Utah and the Pregnancy Resource Center of Salt Lake City, where Evangeline Sanders is president.
The majority of the funding that we will be getting will be going towards making sure that we have medical professionals on site to be able to provide those lab-grown pregnancy testing and the limited ultrasounds.
Mary Taylor is the president of Pro-Life Utah. She told me she had an abortion when she was younger and now works to keep other women from making that choice. She says the new funding will help her organization continue to support pregnant women.
All of that money goes directly to our Life Grant program, things like emergency housing, temporary housing, basic utilities, and medical care through medical clinics or hospitals. And then on top of that, a lot of that money will go to those baby supplies.
But some say these crisis pregnancy centers, or CPCs, have other intentions.
It's not real health care. But, don't take my word for it. You could listen to the American College of Obstetricians and Gynecologists, ACOG. They represent the majority of doctors out there that are delivering babies. They say that crisis pregnancy centers are, quote, run by people who operate unethically and with the intention to dissuade, deter, or prevent them from seeking certain reproductive health care options, end quote.
The Pregnancy Resource Center of Salt Lake City is located right next door to a Planned Parenthood clinic. Janelle Brown, a law professor and bioethicist who has written legal reviews on CPCs and abortion, says that's on purpose.
Sometimes they're licensed providers, sometimes they're not. Sometimes these people who are wearing scrubs aren't actually even nurses, but they want you to think that you're going into a clinical facility. And the purpose of CPCs is to make people think that they are going to see a healthcare provider and then to discourage them from terminating their pregnancy.
And the research backs this idea up. Many studies have been done on crisis pregnancy centers, and the research shows that they commonly disseminate false or misleading information. When asked about this, both Sanders and Taylor said it wasn't true for their organizations. But the medical experts I spoke with say otherwise. Dr. Daniel Grossman is one of them. He's a professor in the Department of Obstetrics, Gynecology, and Reproductive Sciences at the University of California, San Francisco. I asked him about something called an abortion pill reversal procedure. It's something both CPCs advertise.
The abortion reversal procedure is a tried and true procedure that was developed by a doctor and is administered by doctors.
So-called abortion reversal just doesn't exist. There is no evidence that any kind of treatment will reverse the effect of mifepristone and make it more likely for a pregnancy to continue.
And Dr. Grossman says there were a number of other instances where the CPCs spread false or misleading information.
There's simply no evidence. There's no evidence that that's simply not true. It's not fully true because there's no evidence that there's increased risk.
I made a separate post where you can read the full claims in detail and see the medical opinions of two OBGYN specialists in response. Just head to our page to look through them. When asked about these falsehoods, here's what Sanders and Taylor had to say. You can pause the video to read their full responses. Since the overturning of Roe v. Wade, at least 18 state governments have spent more than $240 million worth of taxpayer money to programs that support crisis pregnancy centers. That's according to data from the Guttmacher Institute and Equity Forward. Planned Parenthood of Utah is expecting a state court to make a decision on Utah's abortion ban within the next few months to a year. That means Utah could soon see a near total ban on abortions with very limited exceptions, leading more women to seek outside care and potentially end up at one of these crisis pregnancy centers. For PBS Utah, I'm Cailley Chella reporting.